Okay, good morning, everybody. Any questions before I get going with this stuff?
Yeah, I just have one quick question.
Okay.
Yeah, I remember you said we had like a study guide on Moodle. Are we gonna go over the study guide sometime a little bit later this week, like Wednesday-ish or so?
Yes, I'm gonna try to stop.
Yeah, I just have one quick question.
Okay.
Yeah, I remember you said we had like a study guide on Moodle. Are we gonna go over the study guide sometime a little bit later this week, like Wednesday-ish or so? Yeah, I remember you said we had like a
Yes, I'm gonna
study guide on Moodle. Are we gonna go to the study guide sometime? This week on Wednesday, study guide on Moodle. Are we gonna go to the study guide?
What in the heck is going on? Okay, we will. I apologize for that.
Oh gosh, it scared me a bit there.
Okay, I think maybe fix it. Maybe I'm waiting to hear if I start talking all over again. Okay, I think this is working. There is a study guide posted. My hopes are to wrap up this unit of material today. There's really only maybe a dozen slides. I don't know exactly. I didn't count them, but there's not many left. So my hopes are to wrap lecture up today. Wednesday, I would like to go over the study guide material. So if you've got questions or comments, we can deal with stuff that way. As far as Friday goes, I'm trying to decide exactly how I want to work stuff. Personally, I feel like I like the fact that you have time to start on the test and not think about new stuff. Keeping the test open till Monday, I obviously start material without you guys doing stuff. And looking at the trends, you don't start the test till Monday night anyway. It is highly likely that Friday I will start new material. The last unit of stuff is rather lengthy, so I think having an extra day would be to my benefit. Whether it's your benefit or not, we will see. Okay, so is that good?
Yeah.
Okay.
Yeah, thank you.
Okay. Any other questions? Okay. I think I'm getting back to this. I thought I had YouTube all figured out so it wouldn't start playing automatically. Obviously I didn't. Okay. But it looks like it's recording. It looks like everything is happening like I sort of want it to. Okay. We left off Friday as we started talking about different types of hypersensitivity reactions. There's 4 types we want to think about. We talked about allergic reactions, from simple kind of like hay fever types of allergies to potentials for anaphylactic shock, just dependent upon really the types of substances that you might develop an allergy against. Those are the type 1 hypersensitivities. The type 2 hypersensitivities are what we left off with. Thinking about blood transfusion reactions, incompatibility situations where you get the wrong type of blood transfused into you and your body can mount a response against that. Or the Rh factor, the hemolytic disease of the newborn, where there is the potential for an Rh positive child to be developing within a negative mother. She in turn can be sensitized to that child, and subsequent pregnancies, if antibodies are produced, they target that second child that's in development and potentially for a fatal immune reaction. There are drugs that will block the production of those immunoglobulins and prevent the sensitization of the mother in the first place. So that's really where we left off, thinking those first two. The next one, type 3 hypersensitivity. When we think about these guys, these are like immune complex situations or disorders. There's numerous possibilities. The first stuff, I think really probably the first stuff, if I remember, as I was reading through the text, is the Arthus reaction. And this reaction was first recognized in an individual that was producing antibodies. Oftentimes in immunology, we utilize research animals. We use rabbits for a lot of these things for production of antibody. And so rabbits are easy to handle, to deal with. They produce usually a pretty good immune response, and you can collect all sorts of substances, antibodies, from these animals. So Arthus was doing some research, and he was immunizing rabbits with some horse serum, producing antibodies against that, and recognized over the course of some of these treatments, just like you would get a vaccine, you'd get a booster shot, these animals started developing some weird reactions at the inoculation site that were really significant, something that had never been seen before. And it ultimately had to do with what we will jump forward to the littlest bit and start to, I mean, we do call it an Arthus reaction after him, but it's also a type of serum sickness where you develop a reaction against this foreign substance. So the rabbit, seeing the horse as being foreign and want to mount a response, what kind of makes sense. But then through subsequent exposures to the horse serum, it's more than just the production of antibody. It's really what we're kind of seeing happening right here in this cartoon. So there's all sorts of potential immune complexes that can form. In a normal immune response, these substances would be produced in recognition of the foreign invaders, stimulating other cells to recognize and to respond. That's what should be happening in a normal situation. But if these complexes wind up depositing in tissues, then the situation is much more severe in the host, if you will. So there's possibility for all sorts of areas to be targeted: vessels, the heart, joints, skin, or kidneys, where these complexes may get deposited within the tissues. And subsequent immune reactions trying to target these complexes wind up targeting our own tissues as a result. And you see potential serious issues as a result. So you can see these immunoglobulins linking up to antigens, making these complexes, and then over here, potentially linking up to some of these tissues. That causes a handful of things to occur, some of which you would expect to be happening naturally before we're targeting these tissues. You expect complement to recognize the IgG and to stimulate destruction of these specific molecules. If it targets our own cells, well, that's a different story. And now you've got problems. And you can see other things like neutrophils, where they can degranulate, causing lysis of cells, lysis of our own cells, and other targets. As we see complement linking up to these tissues, that can stimulate other reactions and targeting cells to see these and to destroy. So dependent upon, excuse me, dependent upon the specific cells that get targeted, there's all sorts of different types of immune reactions or disorders that we might see with this. And if it winds up down in the kidneys, as we see in the next figure, you can see serious destruction within the kidneys as these complexes start linking up into the cells, causing what we call glomerular nephritis, swelling, and really potential destruction of the glomeruli within the kidney. And so that sets the stage, potentially sets the stage for requiring dialysis to deal with that. So really pretty impressive. And this, again, a type 3 hypersensitivity, where these complexes don't get dealt with beforehand like they should. and they wind up targeting tissues and stimulating reactions that really are unwarranted. We don't want that stuff happening. The next type 4 hypersensitivities, these are a little bit different as far as the way that the reactions are occurring. This is everything we've talked about is up to this point, we're thinking more of a humoral type of a response, the production of antibody and stimulating specific types of reactions. This is a little bit different because it's a cell-mediated response. So T cells play a huge role in initiating and causing these specific consequences as they get stimulated. So you get exposed to some sort of actin antigens. These are fragments, small bits of the specific substance. In this case, what we've got as an example is poison ivy, and it causes what we call contact dermatitis. It's something that doesn't happen the second that you brush against the poison ivy, right? It takes time. And for that matter, it takes multiple exposures. It's almost really kind of like thinking about an allergic reaction where it takes a sensitizing and then a shocking dose to initiate this reaction in the first place, right? So that's what it's saying here. It's a sensitization initially, and then the shocking dose where you see the ill effects, right? So coming in contact with something like this, brushing against the skin, these antigens are recognized. Our dendritic cell processes, presents, the T cell sees it, produces some memory cells, ready for the next go around, if you will. The second time that you come in contact with this poison ivy, that's when these memory cells are like, oh, I've seen these things before. They release specific cytokines calling in cell-mediated responses, macrophages, cytotoxic T cells, and you can see the typical types of response as a result of some of these substances. So all sorts of issues. And once this happens, second exposure to the poison ivy, it's not, again, not instantaneous that you see this result. It takes time for these cells to send out the message, to call in the troops, if you will, before you see these ill effects. So I've got a story that fits with this pretty well. Poison ivy around here is something that's relatively common. If you go hiking, you might see some of this stuff. Pretty common, all right? So we've got a friend that was from here. She moved to Oregon, and she went hiking with a handful of friends and walks through all of these bushes, and everyone is kind of avoiding, and she just goes right through it. And they're like, holy cow, you just walked through poison oak. I've never seen poison oak. It's not around here, right? She didn't know what it was. She walks right through it, and everyone's like, I can't believe you just did that, poison oak. Nothing happened to her, right? And I am talking to her shortly after this has occurred. And really what has occurred is this, right? It's her first time she's ever been in poison oak, all right? This is what happened, all right? But that's not what she thinks. Her friends tell her, wow, you just walked through poison oak. Nothing happens. Day goes by, nothing happens. No rash, no itching, no pain, nothing. What does she think? Holy cow, I'm immune. I'm immune to poison oak. This stuff doesn't hurt me, right? Shortly after, she goes on another hike, thinking she's immortal, right? Or maybe immune, maybe both. Thinking it's all fine and good, she walks right through the poison oak. And a day later, she could hardly get out of bed because both of her legs were just covered in these nice welty rashes. And then she called me up and said, you know what? I am not immune. And I said, I didn't think you were, right? I was pretty sure not. When she, I was like, that just doesn't make sense. But this is really what's up, right? So it takes multiple times, all right, before you see those ill effects. So keep that in mind as well. We also could think about in this image as we're looking at this, I don't know if I've got an actual picture, I don't, but we could kind of go back to this. Although this is poison ivy, a TB test, there's a little bit of toxoid that gets injected into the skin, and if you have either been exposed or potentially, if you're from some other country, you've maybe been vaccinated against tuberculosis. In that case, you'd also mount a response. And over the course of typically it's between 48 to 72 hours, if you truly have been sensitized, you will mount a delayed type hypersensitivity response. You'd get this similar sort of welting that was shown. And that in turn, like I said, doesn't mean that you are actively infected, could, but that you've been potentially been exposed, like I said, or maybe vaccinated. So just depends. There are all sorts of other potential occupational exposures or situations that can set the stage for some hypersensitivity reactions, some pneumonitis. So we've got a couple right here. The people that are, dealing with birds, chickens, poultry farmers or ranchers. I don't know what you call them. There's another term for it, pigeon fancier's disease, if you are breeding pigeons, whatever it is. And I wonder why they've capitalized people. That's beside the point. All right. They can become susceptible and they get this, we call it poultry workers' lung, or like I said, pigeon fancier's disease, whatever it might be. Over here, as I look at this, I'm like, holy cow, look at all that cheese. Man, that looks delicious. Or as my oldest son would say, just disgusting. I'm like, who in the hell hates cheese, right? That's okay. So some situations with this, there's all sorts of organisms that we can utilize in the production of cheese, bacteria, and some fungi. And in this case, it's a lot of fungi that sets the stage for issues where you can develop cheese handler's disease. And there are numerous other potential issues. You can see agricultural workers, farmers, exposed to lots of dust. Maybe we've got other stuff if you're working with livestock, but inhalation of this can set the stage for issues. There's numerous situations that can result in pneumonitis, and the text mentions a handful of those things as well, not just those two. So this table kind of puts all of this into a quick nutshell as far as the different types of hypersensitivity reactions, the specific types of immunoglobulins or cells, if we get to the type 4, that are responsible for this. So the type 1s with allergic reactions, IgE, is an important player. The type 2, the blood transfusion stuff, IgG and IgM. The immune complex, both same guys, IgG and IgM also. And then the last ones we just thought about, the T cell mediated types of responses. So it goes through and it gives you some potential examples with this. And here's the glomerular nephritis. A handful of things within this type 3 that might be the result of streptococcal infection. So strep throat, Streptococcus pyogenes is the organism that causes that. It can cause issues. Kind of depends maybe on the situation within the host. It also might depend a little bit on the bacterium itself as far as some specific factors, if they are present or not, that might stimulate the progression of this. But in the course of the infection, there is possibility with some of these immune complexes that do not get targeted properly, and they wind up in the kidney, causing issue as they link up with the glomeruli, causing the nephritis. It can go to the heart, and there's others, as we'll think, some of the autoimmune stuff. That's also a complex disorder. Lupus fits within that category. So all sorts of potentials with that, and a couple of different examples. So there are potentials where you may, and this is not the same as the TB test, but it's kind of like that. As we look at this, this individual, and we're looking at the backs of their arms, there are numerous substances, antigens, if you will, that have been injected under the skin. So it's a skin prick test to detect specific allergic reactions, type 1 hypersensitivities. So all sorts of substances. And, you know, I see this on the arms. There are lots of times when maybe they use the back. You got a huge surface area on the back where you've got the ability to go in and test numerous things, all right? And who knows, maybe they use the back, they use the arms, they use as much of you as they can, test as much, right? I imagined that it's probably relatively uncomfortable as you start welting up with some of these things. So you can see areas where stuff has been injected, little bits, and then we've got some areas over here where it's welted up and there's some redness around it, although it kind of all around looks sort of inflamed. Number 3 is what we're looking at right here, and there is a definite reaction. What 3 is, I can't tell you because I don't know, all right? But all sorts of different substances that they're testing, and here we've got a reaction. Over here, maybe there was one as well. I don't know, all right? But this definitely is what we're looking at. So wheals and flares would be really the welting and the redness, the inflammation as a result of that, indicating the type of response being mounted against this specific substance. So whatever it is, all right? And there are opportunities where an individual may see numerous ones of these, and you recognize, you know, you're allergic to all sorts of different pollens, animal danders, things like that. You're pretty sure you ought to maybe just live in a bubble, right? So numerous things that we can potentially detect that you may have allergies to. That sets the stage for other potentials. Knowing that there are things you're allergic to clues you in and lets you know things that maybe you need to avoid. But it also may set the stage for things where we can think of being desensitized or basically stimulating our body to really recognize these things as not the bad guys that we're trying to think that they truly are. All right. So it's not something that you can become desensitized overnight. It takes repeated small doses or exposures to these respective allergens to make the body kind of to train it to think this stuff's okay, all right? And maybe the symptoms completely go away or become much less severe dependent upon the circumstances, all right? There are definitely some situations where you can kind of do a little of this on your own. If you have seasonal allergies, if you have hay fever, and you know there's specific things, you know, in the spring or whenever that kind of hits you, there are some possibilities where maybe eating honey that is collected from local bees, they'll be tapping into similar things that maybe you've got some allergies against. So eating some peanut butter and honey sandwiches may serve to desensitize you over the course of time, getting small little bits of those substances without serious issues. Yeah. Okay. That's a great question. So she is saying, because I know if for those of you tuning in at home can't hear, daughter with some allergies that had similar testing as we're seeing on this figure. A couple of years flash forward, more allergy testing. Some of the stuff that were positives before are now negatives, and some of maybe the negatives are now positives. And her question is, how? What's going on? And that's a great question. So there are numerous potentials. Allergies can be something that you develop very early in life. And some of these things may stick with you for forever. And there are other potentials where you may have it as a young child and you grow out of it, which is likely what you're seeing with maybe the egg white and the corn, just something that over the course of time, maybe a little bit sensitized to that, but growing out of it, her body develops enough to not see that as an issue, and possibly other things, other substances kind of helps to desensitize. It's hard to say. Corn is in all sorts of things. So what it was specifically in the corn, I'm not 100%. Yeah, kind of. So something in there, and probably something that's been processed that's served as an allergen, I would think. So there's definitely potentials for things to outgrow or to develop later. You can develop something, you never had issues, and then later on you start seeing issues with it as well. There's all sorts of potentials with that. So it really it kind of just depends on those circumstances as far as how all of that happens. But there are potentials, like I was saying, with the desensitization, just subtle or small amounts of specific things that are slowly introduced may potentially set the stage to desensitize, right? We mentioned last time a little bit about the hygiene hypothesis, and that we're living in a pretty sterile environment where we don't see lots of disease, we don't see lots of parasitic infection, and maybe that sets the stage for our body to start responding against other things unfavorably. So it's really, I think, pretty interesting when we think about all of the allergies, all of the reactions that we see, and thinking, little kids, things like peanut allergies can be huge, and there's all sorts of issues with stuff like that. But you may look to some other country, maybe a third world country, peanut allergies may not even be on the radar at all. It's not an issue. And it really, that goes back to this hygiene idea. In those countries, it's likely that parasitic infection is definitely on the radar and more of an issue. And so what we've got going on in our bodies might potentially set the stage for some of this stuff in the first place. So it's hard to say. Okay, we're shifting over from that. We want to start thinking about some of the autoimmune situations, and really there's just a handful of images left with this. We're about done with this chapter, I believe. So here we're looking at a goiter. So hypertrophy of the thyroid. This is a symptom of Graves' disease or Hashimoto thyroiditis. So one of the issues with that. Here, another symptom in this, the bulging out eyes, it always kind of reminds me of Beetlejuice with the big bulge, I'm like, oh my gosh, that's obvious what we're looking at there, right? So If you don't, that should be the homework. If you don't know Beetlejuice. All right. Exophthalmia or Graves ophthalmopathy is another sign with these kind of bulging out eyes. Addison's disease, we can see hyperpigmentation as a sign with this. And here on the palms, all like kind of pinkish with that. And there are numerous issues with Addison's. I don't have all of the details with all of the autoimmune stuff. I don't, off the top of my head, I can't just spout off all of this stuff. Graves' disease, myasthenia gravis, not Graves' disease. That was what we had looked at before, but I see Gravis. Here we've got issues with acetylcholine, so impaired contraction of the muscles. Here we've got a normal situation, and here not. So there's antibodies that block autoantibodies, so antibodies against your own stuff, which is the issue with many of these things in the first place. These antibodies come in and block the acetylcholine receptors on the muscle cells, basically making it so that those receptors are already filled up. Acetylcholine is released, and it can't link to those receptors, so you don't see contraction with that. Here is rheumatoid arthritis. I can't tell you if this is the same, but I'd like to think the x-ray and this gentleman's hand, it's the same thing. It doesn't matter. You can see all of the distorted bones, knuckles, all bent up. So definitely, as I look at that, I'm like, that's got to be painful, I would think. And you look at the x-ray, pretty stinking sure that's a painful situation. Here, lupus, there are all sorts of issues with lupus, systemic lupus erythematosus. So ultimately, multiple body sites that can be impacted. There are oftentimes, and this isn't the best image, but there's oftentimes kind of a characteristic sort of butterfly rash on the face. Here you can see this cartoon image, but that's sort of what we're looking at right here, right across the face. So kind of just depends on the circumstances. And there are other issues, as we see here, with circulation, kidney issues, all sorts of possibilities with that. And I think lastly, there are a handful of things that we've kind of glossed over right here. But with the types of immune diseases, there can be primary or secondary types of immune diseases. And here we've got a primary. So this is something that is a genetic situation, something that you have that you're born with, not the secondary, which would be something like HIV as an example, something that you acquire as a result of a viral infection that destroys immune response. So this, if you haven't heard of David, the Bubble Boy, there is a movie about this kid. He was born in the 70s, if I recall properly, with this disease called severe combined immunodeficiency syndrome. Basically, born without an immune response is really kind of the idea. Not able to recognize and to mount a response against pretty much anything, all right? So anything and everything truly has the potential to cause serious fatal infections, things that we think of as being no problem at all, to him could be the end, all right? So lived most of his life isolated inside of a bubble. NASA developed this little space suit for him so he could get out of the bubble, but he is still, well, as you see here, tethered, right, to that. So there are images where they show his little bubble where he lived with like these little glove bits where the people on the outside could put their hands in the gloves, then they could kind of play or sort of give him a hug. He really had no sort of true human contact because that is enough to be the end. So he lived with the hopes that medicine would come up with procedures that would be able to cure him. And he hoped that that would be the case. And it just seemed like it's not happening. Over and over, there was promise and it was failed. Issues. He hit 12 years old and through, I assume, lots of counseling with both he and his parents, there was no cure truly in sight. At least that's how it appeared. And unzips the bubble and crawls out, hugs his parents, gets sick, and dies. Truly a sad situation. A few years after that happens, we've got some genetic therapies, and ultimately we were able to cure a few individuals that had this through gene therapy, manipulating stem cells before, and these children born without the disorder. And it seems like we're on the cusp of this great technology. I truly think that that is the case. However, in the process of dealing with some of these individuals, we didn't cure them. And we ended up causing other disorders, cancers, targeting cells that weren't the proper cells, and some died in the process. Medicine's supposed to be helping, not harming, and they kind of put the brakes on some of this, some of these cures, all right? And now we think more therapy, trying to treat the situation, treat the symptoms, and not necessarily target, those stem cells, target the embryonic cells before they're ever hatched out in the first place, because we're not quite at that point where we're able to really deal with that. I think with CRISPR techniques, we are really seeing all sorts of possibilities for changes with that, all right? But now we think about other situations where you can extract some cells, you can alter those cells in the lab, and you can put them back into the individual. Now they've got cells that are functioning properly and can survive, right? These immune cells, if we're targeting something like this, they don't persist forever. So it requires kind of continual treatment where you go in and get these cells manipulated and replaced to deal with these situations. And there's a handful of genetic disorders where we are capable of treating these situations. We're not curing the people, but we're able to treat, at least at this point, right? So it's really kind of a sad story for David. He was so close to those potentials. But again, at that point, like I said, shortly after, we were trying to cure these people and not thinking about the treatment. Those steps were much later when we started thinking about being able to just do it in a test tube and manipulate some of this stuff. So that's the idea, all right? So this is a primary deficiency, immune deficiency, where it's something that you're genetically born with. The secondary, like I said, HIV, which we don't have images of this, that is something that's acquired as a result of a viral infection targeting the immune cells after the fact, if you will. And I don't think there's any test questions about either of these things. That's why it's kind of just at the end. Okay. That is the end of that. We will stop there. Stop share. Any questions before I let you go? I give you just a few seconds for those tuning in from home. All right. We will pick up here Wednesday with some review. So I recommend you go over that stuff beforehand. And if you've got questions or concerns, I will recommend showing up or tuning in, and we will address all of that stuff. All right. Have a great day.